Hi, my name is Traci Pollard. I'm a continuing education instructor at University of Texas in Arlington. And today our topic is Ebola virus. I'm a licensed nursing home administrator, and we're going to be looking at contact transmittal disease. Our objectives are introduction of Ebola, quick facts about Ebola, recognize OSHA standards related to bloodborne pathogens, identify employers' responsibilities related to compliance with OSHA standards, and some additional general Ebola information. Ebola hemorrhage fever, or EHF. EHF is the disease caused by infections with Ebola virus. These viruses are capable of causing severe, life-threatening disease. EHF is usually marked by fever, muscle pain, headache, and sore throat. The illness progression includes nausea, vomiting, diarrhea, and impaired organ functions. In some cases, it may have external bleeding as well as death may occur. Some symptoms of the Ebola virus may appear consistent with many other illnesses, such as influenza or malaria, which could sometimes cause a delay in diagnosis and treatment. EHF was first identified in 1976. It was identified in Sudan as a Sudan Ebola virus, as well as Zaire Ebola virus. Healthcare workers in Zaire treated the third case in 1976 during an outbreak. Healthcare workers today are among the highest risk group of workers for exposure to Ebola virus. Some cases that were diagnosed in the United States. Just this year, in September 2014, CDC confirmed the first laboratory-confirmed case of Ebola that was diagnosed by a man who traveled to Dallas, Texas from Liberia. The man did not have symptoms when leaving Liberia. However, he developed it, and it was identified in the United States. There was daily monitoring for 21 days after his exposure, and the patient passed away on October 8th. Another case developed on October 10th in 2014. A healthcare worker was identified. And the healthcare worker was isolated after the initial report of a fever and subsequently moved to the National Institute for Health. The patient has since recovered and was discharged on October 24th. A couple of more cases were identified on October 15th. We had a second healthcare worker that was identified, and that worker was from Dallas to Cleveland on October 10th and went to the Cleveland to Dallas on October 13th. CDC workers, to ensure that all passengers and crew on the two flights were contacted by public health professionals to answer their questions and arrange follow-up as necessary. By November 3rd, all passengers on both flights completed the 21-day monitoring period. On October 23rd, there was a case identified in New York City where the medical aid worker had served with Doctors Without Borders. The diagnosis was confirmed by CDC on October 24th. The patient has recovered and was discharged from the Bellevue Hospital Center on November 11th. Some tracing of Ebola contact in the United States. CDC recognized that any case of Ebola diagnosed in the United States raises concerns. Medical and public health professionals across the country have been prepared to respond to the possibilities of additional cases. CDC and public health officials in Texas, Ohio, and New York took precautions to identify people who had close personal contact with the patients and healthcare professionals that were identified. And if you notice the chart at the bottom, it shows you the contact and where the traces were. Currently, we have no identified cases that's in Texas, Ohio, or New York, or anywhere else in the United States. There was completed surveillance in Texas. It was 177 people identified. In Ohio, 164. and in New York, 117 were all cleared of the Ebola virus. Some additional background about the Ebola virus is typically spread through contact with body fluids from a living or deceased person or animal. The infection could occur through open cuts, scrapes, mucous membrane. It also comes in if you come in direct contact with infectious blood or other potential infectious materials. The Ebola virus is identified in Africa, which is most common, and its suspected reservoirs include primates and the bat population. In the United States, there is concern related to possible spread of the Ebola virus among human populations due to the availability and reach of global travel. CDC and prevention categorize the Ebola virus as Category A, select agent. A Category A is a high priority agent that poses a risk to rationalize security due to easy disseminated or transmitted from person to person. This group can also result in high mortality rate and have the potential for major public impact. Some quick facts about Ebola. Currently, Ebola virus and EHF do not pose a threat to most United States workers. However, exposure to the virus or someone with EHF may more likely be in certain sectors, which includes healthcare, mortuaries, or during death care, as well as on airline serving industries. The Ebola virus may cause fatalities up to 50 to 90% of cases. Workers may be exposed to aerosolized droplets with the Ebola virus through medical and housekeeping tasks. Some medical information. The most common route of transmission of the Ebola virus are contact of the eyes or other mucous membrane, contact with contaminated equipment or other objects, contaminated environmental surfaces. Individuals who have been exposed to the virus may be quarantined, isolated if they're suspected and confirmed with cases to prevent the transmissions to others. The Ebola virus is believed to be viable outside of the body for several days. It could remain stable for 4 to 5 days in dried blood. Symptoms of the Ebola virus typically appears most common within 8 to 10 days, following the infection, and runs its course for 14 to 21 days. So what occurs during these 21 days? If you notice in the diagram, the first symptoms may show up within day 7 to 9. A person may experience headaches, fatigue, fever, or sore muscles. By day 10, it could be sudden high fevers. They could experience vomiting blood or passive behavior. On day 11, they may see bruising, blood from nose or mouth, the eyes, as well as brain damage. The final stages would start around day 12. They may have loss of consciousness, seizures, massive internal bleeding, and of course including death. Ebola outbreak is the deadliest virus. It has killed at least 59 people in Ghana. Ebola is spread by close contact and kills between 25 and 90% of its victims. OSHA standards require employers who workers may be exposed to the Ebola virus would likely need to comply with provisions from a combination of standards. One of the standards would be the OSHA's bloodborne pathogen standards, which is found in 29 CFR 1910.1030, and it will cover the exposure for the Ebola viruses. In situations where workers may be exposed by bioaerosols containing the Ebola virus, employers must also provide and follow the OSHA respiratory protection standards, which is found in 29 CFR 1910.134. Other elements of the infection control for Ebola includes a number of precautions for contact transmittal diseases are covered under the OSHA personal protective equipment, and that's in 29 CFR 1910.134. Employers may also be required to follow other standards to protect their workers from exposure to chemicals used for cleaning and disinfecting, and it depends on the specific chemicals that are used would be a different or additional PPEs that may be required. Following good hand hygiene protocols, safe injecting practices, and other infection control techniques may further reduce healthcare workers' exposure to the Ebola virus and other infectious agents. This is just a diagram that I found where it gives 6 ways to possibly prevent the Ebola virus. It shows that if you avoid physical contact with someone that may show symptoms of the Ebola virus, also in keeping away from any animals that may have the virus, washing your hands regularly with clean water and soap. And these are just some ideas. When traveling, you want to make sure that you kind of pay attention to anyone that may have potential symptoms. So the employer's responsibility for their employees to survive the Ebola virus. Some ideas would be control and prevention. Healthcare workers, employers of healthcare workers are responsible for following the applicable OSHA requirements, which is found in the OSHA bloodborne pathogen standards. Employers must provide proper PPE and other infection control measures to avoid exposures to infectious blood and body fluids, contaminated objects, or other contaminated environmental surfaces. Employers must provide guidance on PPEs to be used by healthcare workers during management of patients with Ebola virus disease, including procedures for putting on, which is donning, and removing, doffing, the PPE according to CDC and Health and Human Services. CDC recommends for United States healthcare workers caring for patients with Ebola to use the following PPEs. To give you a list, they recommend that surgical scrubs or disposable garments are used. They should double glove, wear boots that cover that are waterproof and they extend at least mid-calf or leg covers. Single use of fluid resistant or impermeable gowns that extend at least mid-calf. Disposable N95 or power air purified respirators. Disposable full face shields. A waterproof apron that covers the torso to the level of the mid-calf, and it should be used if Ebola patients have been vomiting or have had diarrhea. This is just a diagram of the new guidelines. CDC protective gear, previous guidelines shows that goggles and safety glasses or a mask or respirator, whereas the new guidelines shows that the mask must be disposable. For the face shield, you have the gown for previous, but the new gown should be fluid resistant. On the previous, it shows one glove. On the new guidelines for the Ebola virus, healthcare workers should use 2 pair of protective gloves. Notice on the previous guidelines that there are no leg or shoe covering. However, for the new guidelines, they must wear fluid-resistant pants and shoe covering. These are the new guidelines that CDC has since put out for the Ebola virus. For airline and other travel industry personnel, CDC and OSHA is working with them. Workers involved in airline and airport services operations include flight attendants, cleaning and provision staff. Cargo personnel may be exposed to the Ebola virus in a number of scenarios. The exposure to infectious body fluids in laboratories, direct exposure to individuals sick with the Ebola virus, employers should educate workers about the hazard of exposure and provide reasonable means to abate the standards or the hazards. FAA, or the Federal Aviation, and OSHA has an agreement where the safety and health of flight crew are under the jurisdiction of FAA, and such workers are generally not subject to OSHA requirements. However, under a policy adopted by a memorandum of understanding between FAA and OSHA, these employees are subject to OSHA's bloodborne pathogens, noise, and the hazardous communication standards. Some additional resources: general Ebola information. You can check the CDC website for control and prevention. You have information resources for Ebola virus through the World Health Organization, known as WHO. Bloodborne pathogens, infectious diseases through NIOSH, National Institute for Occupational Safety and Health. And then workplace safety and health topics for Ebola, NIOSH, CDC, and United States Department of Health and Human Services are additional resources for workers. Some risk communication information: workers should be aware of the exposure risk levels associated with their job duties. In addition, a pandemic may disproportionately affect people in certain age groups or with specific health histories. At the bottom, you'll notice that there's 3 categories. Very high and high exposure would be healthcare workers, particularly those that are working with known or suspected pandemic patients. Medium exposures are workers with high frequency interaction with the general public, such as through working in schools, restaurants and retail establishments, travel, and mass transits. And then low exposure risks, which is still a caution, are workers who have minimal contact with the general public and other co-workers, such as office workers. More resources dealing with cleaning and decontamination. The guidelines for the Ebola surfaces: workers must wear appropriate PPE when conducting cleaning and decontaminating activities. Immediately clean and disinfect any surfaces contaminated with blood, urine, and any other body fluids that are suspected or known to contain Ebola virus. Anyone that may have been exposed should be isolated, and contamination under decontamination is completed to minimize exposures of individuals not performing the work. Signage should also be used to restrict access to areas of suspected or known Ebola virus contamination. Treat any visible contamination with suitable disinfectant, and allow disinfectant to soak into spills for the recommended time for specific disinfectants being used. And you can get that information off the manufacturer's instruction. Below, you'll see the website where there's a PDF that OSHA has developed for cleaning and decontamination. Just a reminder, our goal is to improve employee safety, to enhance our care of residents, keeping them and their families, ourselves and our families safe. And just an idea, we wanted Ebola to know that it picked the wrong country to mess with. So we want to think safety, not just compliance.